Welcome to the beautiful world of dermatology. One of the things I love about dermatology is I get to work with a lot of fun equipment. These are two of our lasers that we use here in our office. This one does a couple of different things. This one is dedicated to one specific thing. Let's talk about this one first. This is our CO2 laser. The CO2 laser uses a beam that is fractionated, or it's divided up into a lot of different particles. The beam then vaporizes some of the tissue of the skin in these little microscopic columns. As the skin heals around those little microscopic columns, the skin will tighten. In addition, the CO2 laser will stimulate a lot of collagen because it stimulates the fibroblasts in the skin. So this is the laser that we use for a lot of our resurfacing procedures. Patients that want to get rid of a lot of their wrinkles, patients that want to improve their acne scarring, patients that have wrinkles around their crow's feet, smokers' lines. So this laser is the one that does all of that. There's more downtime with this laser compared to this one, meaning you're probably not going to be going outside. You're going to be wearing a lot of restorative creams and ointments afterwards so that you can get the best healing. So this one does require some more downtime, but the results are a lot faster and you have fewer treatments compared to this laser here. I want to show you the hand pieces for the CO2 laser. This one is the one that we use for more superficial skin resurfacing. We use this one for pigment, fine surface wrinkles around the eyes, and other areas. This one we use for deep scars, wrinkles. When we use these in combination, they work really great for many of our different scars. And depending upon which type you have, we can use the different lasers with different settings to help to get you the best improvement possible. So this laser is our M22 laser. This one has a couple of different options that are available to us. Similar to this one, we have the Resurfix. Resurfix is a non-ablative fractionated laser. What that means is that it heats up a column of tissue rather than vaporizing a column of tissue like the CO2 laser does. So this one, you may only have a few days where you're sitting inside, staying cool, it's hot, it's red, but the repairing process happens a lot faster because you haven't vaporized some of that tissue. You probably need a few more treatments with this one, but you can go through a weekend and then go back to work. Whereas this one, you're going to be taking probably a week off. After the Resurfix laser, we have an attachment here that's called the ND-YAG laser. The ND-YAG treats hair, but its main focus is treating vessels. We use this to treat vessels around the nose. It is one of my favorite procedures because we can see those blood vessels shrink up and disappear. We also use this to treat the blood vessels on the legs. Anywhere where there's a blood vessel, it's such a fun procedure to do, and the results are phenomenal. Then this laser head will be removed and we can replace it with the IPL laser. IPL stands for intense pulsed light. What happens is we take some of the filters that are inside the laser, put it into the IPL handpiece, and depending upon which filter that we want, we will be able to target different aspects of the skin. Some of the filters specifically target melanin. Melanin can be found in our hair, so we use it for hair removal. Melanin is also found in some of the upper layers of our skin, so we can treat dark pigmented spots, freckles, sunspots, other things like that. We also use this to treat some of our acne patients who have redness, our rosacea patients. This is one of our most versatile lasers. We love working with this laser. Two really important aspects of laser treatments are the cooling as well as the smoke evacuation. So we use something called the Zimmer cooler. The Zimmer cooler feels phenomenal, keeps the skin cool. We also use it for our IPL treatments. When we're trying to treat hair, we want the laser to target the hair and not the skin around it so that we don't get any pigmentation changes. With our evacuator, our smoke evacuator, it's so important to use this to protect not only those that are performing the procedure, but also those that are receiving the procedure. Because the tissue is vaporized, there's a little plume of smoke that's created, and that smoke is something that we evacuate with this filter. We are so excited to have so many different treatment modalities for your skin. We would love to see you and develop a plan that's specific to your skin type to help you address the needs that you have to help put your best face forward.